The goal of health education programs is to improve people's physical, mental, emotional, and social health. This is accomplished through expanding people's understanding of how to care for themselves and altering the attitudes they have regarding this topic. Prevention, increased health equity, and the reduction of negative health outcomes, such as decreased availability and accessibility of health services, are the primary foci of health education. This education is beneficial to all stakeholders. Today's video is about what is health education and its importance. What exactly is meant by health education? Individuals and communities can learn how to live better lives by receiving instruction from health experts who work in the field of health education. Health education experts are responsible for the implementation, development, and evaluation of programs that are intended to keep people healthy in their day-to-day lives. This is accomplished by combining knowledge from the biological, environmental, psychological, and medical disciplines. Health educators receive the training necessary to evaluate the health requirements of their communities, as well as to plan, create, and carry out the implementation of health programs and communication techniques in a variety of settings. Importance of health education. The education students receive regarding their health is of critical significance. They are given the opportunity to become aware of the dangers associated with the use of illegal drugs, smoking, and consuming alcohol. It helps prevent mortality as well as illnesses such as diabetes and obesity, as well as infections that are transferred sexually. Parents and kids alike need to have a solid grasp on the significance of receiving a health education while they are still in school. Students gain confidence, along with new abilities and information, as a result of this. Emotional health, social health, physical health, and mental health should all be covered in the required curriculum for health education in schools and colleges at all levels. These are all incredibly significant in their own right. The World Health Organization sees school health programs as a strategic means to prevent important health risks among youth and to engage the education sector in efforts to change the educational, social, economic, and political conditions that affect risk. As such, World Health Organization promotes school health programs as a way to prevent important health risks among youth. Every institution of higher learning should have a solid grasp of the significance of health education. These schools are also sometimes referred to as schools that promote health. These are highly significant because of the following reasons. Promote both healthy living and academic growth using every tool at its disposal. Encourages health and education officials, teachers, teachers' unions, students, parents, health providers, and community leaders to participate in making the school a healthy place to learn and work together to achieve this goal. Well, do you like what you are seeing so far? Don't forget to like and subscribe. Keep watching because you don't want to miss the end. It encourages open-door policy regarding access to health and wellness resources. Education about health gives community members who have a stake in healthcare more agency and sheds light on important issues. These individuals put in the effort to guarantee that all members of the community have equal access to the medical resources and information available. When it comes to promoting equal access to medical care, practitioners of the health professional can assist in resolving a number of challenges, including the following: racial and ethnic disparities in health, differences in socioeconomic status and well-being, disparities in the health of men and women, uneven health conditions in rural areas. Professionals in the healthcare industry often do research within their communities on a variety of topics related to health and well-being. The members of the society then set out on a mission to redress inequities in the access to and delivery of healthcare together with other members of the society. It aids in our comprehension of the health policy of the government. The public's awareness of how the government approaches healthcare policy can be significantly increased by improving health education. It makes it easier for the general people to comprehend better guidelines on a variety of concerns, including public smoking, roadway safety, and different diseases. In addition, well-being education frequently requires the engagement of citizens, which contributes to the dissemination of information throughout the community. It contributes to the growth of the economy. An outstanding education in health and wellness will be very beneficial to the economy. It will reduce the amount spent on medical care and the amount of time lost due to illnesses that are easily treatable. To give one example, the annual cost to the United States of obesity and cigarette usage is well over $1 billion. Concerning the latter point, research indicates that smoking has a cumulative economic cost that is greater than $300 billion each year, considering the following factors. Direct medical care costs for adults amount to approximately $170 billion annually. Over $156 billion worth of lost productivity as a direct result of early deaths and the dangers associated with secondary smoking. Through education, citizens can learn how to manage their health habits in a way that is both cost-effective and beneficial to their overall health. As a result, this contributes to an increase in the economic output of the community. According to the source that was just quoted, states that have effective tobacco management strategies see a return of $55 for every dollar that is invested. Diabetes is another data that testifies to the good impact that health education has on the economy. This particular figure has to do with the fact that more people are getting diagnosed with diabetes. The provision of the National Diabetes Prevention Program comes at a cost of around $500 per individual across the nation. It is a significant reduction from the annual cost of diabetes management, which is around $7,800 for each diabetic patient with type 2 diabetes. It encourages young people to participate in healthier lifestyle habits. Youth who participate in health education activities gain the knowledge necessary to take steps toward improving their overall health. They will be knowledgeable about, among other fundamentals, improved eating habits, exercise, and so on. Nevertheless, they will be forced to reflect on their own health, which will make them more amenable to adopting healthy behaviors as a way of life. Do you require an essay on various health-related topics? Find an online essay helper who is both experienced and has a good reputation. It reduces the incidence of early deaths. Citizens are instructed in a variety of strategies to prevent the spread of diseases through health education. They will be in a position to better prepare themselves for diseases that cause death and suffering in the community as a result of this. Through health education, both the general population and, more crucially, expectant moms learn about the significance of receiving certain vaccinations and medications throughout this stage of development. This understanding helps to guarantee better prenatal and postnatal care, which has a significant role in reducing the number of deaths that occur in young children. So, that's it for today's video. What do you of our video? Hit us up in the comments and let's chat. Don't forget to like, subscribe, and turn on the notifications for our channel so you never miss what's coming next from us. Thanks for watching.